scholars and as well as UG scholars. Today, really, it's a great opportunity for us to know about the Panchakarma procedures, especially at Vamana. As you know that Medical College is going to perform more than 300 patients in a year, and even like that Government of Fire Medical College, Mysore and Bangalore, we are all doing the enormous procedures with completion or with perfection or even slight there is a deviation in the perfection, but still we are continuing with our legacy doing the by performing the Panchakarma procedures. Today it's an opportunity to learn and to know what are the standardization we can make and we can update for the procedure of Vamana Karma. In this regard, I would like to invite, call upon today's guest speaker, Dr. Sachin Chandaliya sir, over the dais. And sir, as you know that sir is a very vast experience. He is a senior professor and the head of the department working as a professor and HOD in the College Sri Ayurvedalaya, Ayurved Mahavidyalaya, Nagpur, Maharashtra. On behalf of Karnak Institute, I would like to call upon Dr. Ayush Sugur sir. Please welcome our today's guest speaker, Dr. Sachin Chandaliya over the dais. And I won't take much of your time. Straight away, I would like to hand over the stage to the Sachin sir for his deliberation. And post presentation, there will be a discussion session. If you have any queries regarding the standardization of Vamana Karma, that's one part. Apart from that, if you have any doubts regarding any sort of the questions related to Panchakarma, you can feel free to ask. Okay. By these two words, I will hand over mic to the sir.
Thank you. Thank you, sir. Thank you, Vinod, sir. I again thank Dr. Rajesh, sir, Dr. Vinod, sir, our beloved principal, Shida, sir. So, today I'm going to talk on standardization of one process. Okay. As all of you know, everybody knows in this hall that amongst all the Panchakam procedures, woman is the most. Am I audible? Last, am I audible? Woman procedure is the most riskier. Am I right? It's quite scary, na? It's a bit tricky also. It's a bit scary also. So, if you want to become a Panchakam expert, I think the procedure which you must be master of is the woman procedure, because Virechana, Basti, Nasya, all all the procedures are there, but they are not that much scary one. This creates some fear in the patient also and the physician also. Am I right? Okay. Huh? Okay. So, carrying out the woman procedure needs good expertise, right? But still, why I like it? Because it, as compared to Basti and all the procedures, all the other procedures, uh, it takes lesser efforts and lesser human resources as compared to Basti, lesser human hours also. If you are going to perform woman procedure, as a physician, you are active for not more than 1 hour or 2 hours. But for Virechana, you need to be present for the whole day. For Virechana, you need to attend the patient for the whole day. For Basti, you need to attend the patient for 8 days or 16 days or 30 days. Again, you need the massagist and the whole Panchakam setup. Ready for the Basti procedures, you need a lot of dravyas and all those things. So, from the point of view of the investment, also, it is a bit more costly from the physician point of view. And Vamana, if you are performing Vamana, you can charge 10,000 also, 15,000 also, and you are investing your only 1.5 hour. So from my point of view, from economical point of view also, Vamana is much more easier. If you are expert in it, it's much more easier than Vamana and sorry, Virechana and Basti. Next slide. So if you search the history of the medical practice, you will come across with the procedures like Basti and Virechana. But Vamana is not observed in the history of the other parts of the world also. Next slide, please. So just as I said, commercially and by reputation, if you are performing, if you are woman expert, amongst the Vedas, you will have you will have great respect if you are woman expert. So from my point of view, one should achieve or attain the expertise in the Vamana procedure. Next slide, please. So we'll move to the topic standardization of Vamana. Next. So what is standard? Standard क्या होता है? What is standard? It's a bar, a set of parameters on which you have the uniqueness. So average out, equalize, homogenize, systematize are the synonyms of the standard. It's a grade, measurement, model, pattern, average, mean, level or norm. If I'm saying that this is the standard, then there are some particular things about the standard. Anything, if you are saying that it's a standard, then it should be having the uniqueness throughout. If Vamana procedure, if I'm saying that this is standard, then it should be carried out in the same procedure throughout India. Throughout whenever you are doing Vamana, whenever anything is like if I'm saying that blood sugar level, normal blood sugar level is what is the standard of the blood sugar level? Normal fasting. Hello, UG. What is standard? What is BP standard? Diastolic, systolic. What is DT? This is standard, na? So likewise, if you are asking for standard, it should be unique to standard. So if you are going for a woman procedure standard, there should be some uniqueness. So that is called as standard. So standardization of woman, systematization of woman process, or study to set some norms or means or average of the process or systematic standardization of woman process. This is called as a standardization of woman process. How to approach towards the woman process. So while doing the standardization process, you have the two major components. One is the process standardization, and second is the drug standardization. Out of that, drug standardization needs a lot of work, needs a lot of resources, needs a lot more efforts than expected. Because if you want to standardize any drug, you need to standardize the alkaloids and all those things on the right now on the modern pharmacology parameters. What we can achieve? We can achieve the process standardization. Next slide. So SOP, that is standard operative procedure of the Vamana process. So Vamana procedure, everybody knows. What is the definition of the Vamana procedure? Expulsion of doshas from the oral route of the body is called as Vamana. Next slide. These are the various etymology. I want to attract your attention towards this
particular words. Mardane, Chardane, Nisarne, Sargavishandanam. Mardan is the destroying, crushing or grinding. Then Nisarne is the running away from or falling out. Here, Swarga is the Gati Gamanam and Avishanda is the oozing or flowing and running. So in this procedure, we are achieving or we are doing all these things. Am I right? Are we crushing something? Are we grinding something? Not in literal meaning, but similar to that. You are putting pressure over various srotasas of the body and asking doshas to come down to the koshta, and then you are expelling those doshas from the oral route. Am I right? Okay, next slide please. So process standardization adopted by text. Okay, what do you think? What our texts are? What is Panchakarma? The Panchakarma term itself is a standard term. Whenever you say Panchakarma, then you visualize 5 procedures. Am I right or wrong? It's a standard word. So whatever have been written in the Sahitas are the standards. If I am saying that 4, 6 and 8 Vedas are indicating the Avara, Madhyam and Uttam Shuddhi. Am I talking about standard or not? Yes or no? Yes, yes. Jago. So Sahitas or the text have set the standards for everything. Doshas kitne hain? Am I right? So it's a standard. Usse kam bhi nahi, usse zyada bhi nahi. So these are the standard means. Na? So whatever the granthas and or texts are saying, they are talking about the standard things, right? They have set the standards already. We are just validating it. We are just verifying it. We are just approaching towards all those procedures in a modern manner or in you can say current manner. उस तरीके से देखने की वजह जरा हम अपनी तरीके से देखना चाहते हैं, राइट? चलो देखते हैं. So these are the standards by the text. They have how to carry out the procedure is already explained by all the texts. Is it same throughout the text? PGs. No PGs. PGs कहाँ पे? यहाँ पे आगे? अरे यार बैठे. Okay. So what do you think? Is the Vamana procedure exactly the same in Charak, Sushruta, but what do you think? Different. Then what are the differences? We should to find out those differences. We should satisfy the queries. So Charaka has set the procedure in a different manner than Vagbhata and Sushruta. What is the difference? We'll discuss, right? So this is the procedure which is explained by the Charaka. Atas Chardaniya Maturam Dvayam Trayam Vasmaya Svedopannam Shvarshardayam is the procedure, right? This is the standard. यहाँ से start होता है. Nirannam Anatisnigdam Yavagva Ghrutavantam Pitvantam. This is the first step. Second step, you have to administer the kashaya, right? And third procedure, you have to continue the Visheshena Puna Pitta Agmana. This is the third procedure, which is said by the Charak. पहले आपको यवागु देना है, उसके बाद वामक योग देना है, और उसके बाद वो कंटिन्यू करने के लिए वमनोपो द्रव्य देना है. Next. Sushruta didn't explain the procedure in a sequential manner. What he has done, he has given the Purvanne, Sadharane Kale, and he is asking all the physicians to administer the Vamak Yoga. Then he compares it with the Virechana and then says that this type of people whom Sukumaram, Krusham, Balam, Vruddam, Virumva, Vamanam, Satyeshu, Vikareshu, Shira Dadi Chakrayava, Guna, Manyatamam, Akantam Paya. He has not mentioned when to give. He has just given this type of category. If you are coming across with the people who are having this type of properties, you give them Akanta Pana and carry out the procedure. But in which manner, in which sequence, they are not clear. Next slide, please. then comes Sangra, and then comes Rudaya. Sangra has cleared everything. Here, 2 to 3 things which I would like to say. Janu संस्कृत उपदान उपश्रयान asnovivistam niranamishat snigdam. This is the first thing. Then this is the second thing, and this is the third thing. He has cleared what? First, give the what is saying? बिठाइए, फिर यवाबू दीजिए, फिर आकंठपान कराइए, and then continue the procedure with the Vama cube. Next slide. Now coming the last. This is the last. Here, Vagbata has cleared everything. What we currently do, what we are currently doing or adopting, this is the safest procedure. I have carried out the procedure by all the text. हर एक का अलग-अलग group करके I have carried out the procedures. चरक से there are the two broad categories through which you can carry out the procedure. Charka has not mentioned the Akantapan Varnan. He has not suggested to go for the Akantapana. These are the development of in the coming after Charka. So here first Nirannam Ishat Snigdam Va Peya Pita Sarkisha number 1. Number 2 Akantam Pai Yatmadhyam Kshiram Ikshurasam Rasam is the this is Ikshurasam and this is Rasam. This is Mouse Ras. Third, Yatha Vikar Vehitam Madhu Saindav Sanyutam Kushtam Vipajya Vaishajyam Mantram Mantra Vitam. So this is the third one. So you give the Madhu Saindav Yukta Vamakyo. These are the three distinct, and then you continue the procedure with the Vamanopak Dravyas. These are the various procedures out of which Ashtanga Hrudaya has given the one sequential pattern which we can adapt for our practice. So currently we are following this practice. Next slide, please. Next slide, please. Actually, there are a lot of things which can be explained in that initial period. But as today's my topic is something different, which we are going to discuss further. So I'm not going in details of the Akantapan, then Yavabu, and Vamanopadravya. We will go further. So this is a standard procedure which we are adapting right now. First we do the Pachana, then we do the Abhyanta Snepana, then single rest day, then Bhaya Abhyanga, Bhaya Svedana on the rest day, and Vamana day, the specific about Krishnahar, the preparation of the medicine, Vamana procedure, Sonsajan Kram, Dhumapana, diet regime as per the Shuddhi, depending on the Shuddhi. Next slide, please. So Pachan Dipan Karma. Initially, yesterday also we have talked about it. These are the two sutras which suggest us to go for the Pachan Karma before the procedure, Vaman procedure. Sangra says Uttejanam Utashasya. So to stimulate the Agni, because we are going to administer Snehapana after before the procedure, and you need the good Agni for Snehapana. So Uttejanam Utash मतलब Agni. So Uttejanam Utashasya Koshna Lagokaricha. And so Hruday is saying Pachane Dipani Snehi Tan Svedesha Parishkrutan Shodhay Shodhanay Kare Yatha Sanam Yatha. So this is the sequence in which we have to carry out the Purva Karma. Then first you have to go for the Pachana, then you have to go for the Abhyantar Snepana, then Abhyanga Svedana, then Kaput Klishkar Ahar, then Vaman procedure, then Paschat Karma. Paschat Karma, Dhumpan, Gandush and Sonsajan Karma. Next slide, please. So yesterday, for last 2 days, we have discussed a lot. I'm not going to discuss anything further. This is the Snehapana details. Next slide, please. The Pachana and Abhyantar Snehana. Now coming to the rest day. So how many days should be given for the rest? Sure? Pakka? Other opinion? Yes, please. Yes, please. Next slide, please. Vamanam punha ekaham dinamanyacha kapam utklesha tat kare. Right? So ekaham dinamanyacha is the word where Vagbata is suggesting that we can give the rest days for the rest day for 2 days, right? So gap single day one day यदा तु स्नेहात अनंतर वमनमेव उपयुक्ते तत् एकाहम अनेनैव प्रकारेण स्निग्ध द्रवोष्ण धनोत्तर स्मुख स्वेदमाचरं स्थितो अन्यच्च दिनं द्वितीयम अह कफमुत्क्लेश स्थानात् प्रत्याव्य स्थितो वनं. He is saying that first day, on the first day you go for the snehan svedana, and on the next day you go for the kapha ahar, and then you can administer the woman. So this is the different opinion which is given by the Vagbhat. स्निग्धस्य द्वय विश्रांतस्य वमन कार्यमित्याह वमनमिति स्निग्धहम एकाहम विश्रांतो द्वितीय दिने कफकरे कफमुत्क्लेश्य तृतीय वमनम कुर्यात् is the Himadri's version. Then why we are following one day? Why are not going for the 2 days? What do you think? There is a glitch. There is a glitch. This is the alternative. This is the alternative given by Vagbhat. कि एक दिन में नहीं हो रहा है, 2 दिन भी कर सकते हैं. For what is the reason he is providing? Kapha utklesha tat kare. If the kapha utklesh is not enough, if you are feeling that kapha utklesh is not enough, you can go for the next day. Still, why we are adopting the only 1 day pattern? Because it was suggested by Sushruta also and Charak also. Vagbhat has given the extra day. Why? There might be the reason. Okay. So, the basic for carrying out the Vamana procedure and Virechana procedure, the difference is the proper proportion of the quantity of the kapha is very important. If you are before Virechana, you have to give the gap of 3 days, and before Vamana, what is the difference? Why 3 days? यहाँ पे 3 दिन क्यों नहीं और वहाँ पे 1 दिन क्यों नहीं? Yes, exactly. We need more kapha for the Vamana and we need less kapha for Virechana. Kapottaram Ishardeti. Everybody knows Chelsea this one by 9. So if you are prolonging the duration, there is the natural tendency of the body, or there are the chances that the quantity of the doshas or quantity of the kapha may get depleted during that period. That's why we are avoiding that. Instead of that, we are going for the 1 day. Next slide, please. Okay, स्नेहन स्वेदन कितना दिन करना है? Yesterday also we were talking about that. 2 days, 3 days. There are some practices in the whole country. There are practices that a lot of people are doing Abhyanga Svedana on during the period of the Snehapan also. They ask the patient to take the Grita early in the morning and ask the patient to come in the evening in the Panchakarma for the Abhyanga Svedana. Is it the correct practice? No, it's a wrong practice. That's why I'm dragging your attention to this word. Dvayam trayam va sneha sedo kupannam. Chakrapani says, Etaccha abhyanga sneha sveda sahita sneha sveda karanam pana snehanta divasamarabhya kriyate tena sneha pana vishram dinen samam dvayah treyah purnam abhyanga sneha sahita sveda prayagasya bhavati. He's saying, 2 या 3 दिन कैसे? पान स्नेहांत दिन, last day of the Snehapan, then on the Vishranti day, and then before the woman procedure. Okay, woman procedure के दिन भी करना है, ऐसा clear cut है? नहीं, उसमें हम लोग चक्रपाणी again confirm it. Next slide please. स्निग्धाय देयं वमनं यथोक्तं वान्तस्य प्यादि अनुक्रमश्च स्निग्धस्य सुस्विन्नतनो यथावत् विरेचनं योग्यतमं प्रयुज्य संप्रति क्रमश्च इति प्रश्नस्य उत्तरं स्निग्धाय देयं वमनमिति वमनपान दिने अभ्यंगेन स्निग्धाय वमनं देयमिति अर्थः. So early in the morning also, during on the day of the Vamana, we should give the Abhyanga. Next slide please. Woman room. Woman room कैसे होनी चाहिए? निवात. Sure. Woman, whenever you are going for Vamana, a lot of times after Svedana, the patient gets fainted. If a lot of people, a lot of physicians must have come across with that. Why? Due to the lack of ventilation. That's why this is the word, typical word used by the Charak. Nivatam Pravata Ekadesham. The room should be such that if you there should be the ventilation. but there should be the space where there will be the minimum ventilation at the procedural part. In the procedural part, there should be the no ventilation, but the ventilation of the whole Panchakarma theatre should be proper. You cannot suffocate the patient. There are the possibilities, ना. पहले के दिनों में थोड़ा सा पहले के 3000 साल पहले जाइए and imagine how the Svedana procedures might be going on. There were no gas. Was there any gas? LPG? No. What was the fuel? Cowdung? लकड़ियां, है ना? उससे जो हीट जनरेट होती होगी स्वेदन रूम में, what do you think? How it might be? That's why the room should be nivatam pravatingation. There should be ventilation also, so that the patient should not get the suffocated. Next slide, please. This is very important. Woman chair. A lot of times we miss this point. We do the whole procedure in a proper way, but we don't follow the basic rule, how the procedure should be, how the woman chair should be. Woman chair should be Janu Sama Sambadam Suprayuktah Tarunottar Pracha Upadanam. What does that mean? आप जो आसन पे बैठे हो, how is that? This is Janu Sama Sambadam. Your asana should be, woman chair should be such that the legs should be in a 90-degree procedure, 90 degree. What does that mean? The Vamana pit, where the patient is going to vomit, that should be at this level, not above that level and not below that level also. What will happen? What will happen? If the chair is above the Janu Samsambadam, how we carry out the procedure? आप जरा अपने आपके कुर्सी के सामने इमेजिन कीजिए, थोड़ा सा ऊपर है, अगर आपने जो बकेट है, जो टब है, अगर आपने थोड़ा ऊपर रखा है और आप उल्टी करवा रहे हो, what will happen? If it is up to chest level, what will happen? Is it easy? No. What will happen? Why it is not easy? Okay. There is a mechanism, physiological process is there. For Vamana process, there are two pressures. The two pressures are important. One abdominal pressure and one thoracic pressure. There is a correlation, or there is you can say syncing between these two pressure. Synchronization between these two procedures. What happens? For expelling the bout, what happens? Abdominal pressure gets increased, thoracic pressure gets decreased, right? Thoracic muscles gets relaxed, abdominal muscles get contracted, and the bout is thrown out. If you are holding the chair like this, what will happen? Enough pressure cannot be created by the abdominal muscles. Okay. Apart from that, these are the muscles which hold your back in a straight manner. Which muscles? Back muscles and neck muscles. Why they are important in the procedure? Do you know the property of these muscles? Back muscles and neck muscles? Those muscles are called as anti-gravity muscles. I am standing straight. You are sitting up straight, right? Why? Who is holding yourself straight? Your spine and your back muscles. So these back muscles are helping you during the process. If you are not able to bend forward in a proper manner, these muscles get strained. For that purpose, the chair should be such that the woman tub should be at your Janu Samsambhadam, and you should be in a 90-degree position. It's a practical suggestion by Charan and followed by the Sangraha. Next slide, please. So, selection of the patient, inclusion, exclusion, screening, and routine purvakarma. Next slide, please. I will not go into details of the inclusion criteria. All of you know that. Next slide, please. Next slide, please. These are the modern diseases: Venous, Navajvara, Kasa, Kapha Pradhan Shwas, Shripad, Mandagni, अभिसंधि अभिसंधि भी आ रहे हैं, अनवबद्ध दोषम तीक्ष्णाग्नि बलवंतम बहुदोषम महाव्याधिपरीतम and woman satmam. The patient should be woman satmam. What does that mean? All the other you can understand. What is that woman satmam? We have the habit in our clinic. One question is always asked to the woman, every woman patient. What is that question? PGs. हाँ, PGs एक सवाल आपको कंपल्सरी आपके सर ने बोला है पूछने के लिए. What is that? Every woman patient should be asked. Before going for woman, please raise your hand. No, आपने जिंदगी में पहले कभी वोमन किया है, उल्टी हुई या नहीं हुई है? This is the most important question you should ask the patient, because sometimes a lot of patients I have come across who never had a bout of vomiting in their throat like. So there are the patients who don't have that vomiting center in their brain. So if you are taking those patients for Vamana, they will not be able to produce the Vamana process. That's why this particular word has been quoted by Sushruta. Vamana Satmyam is very important. Next slide, please. So practical inclusive criteria: Kapha Pitta dominant, below 55, good physical strength, and swastha or physically fit. These are the 4 major criteria in which you can go for the Vamana process. Next slide, please. Contraindications of Vamana. I will again not go into the details. Next slide. These are some practical things. This is woman pit. I will show you some photos also. This is my woman pit. I'm showing that. Here we have the adjustment. हम लोग नीचे ऊपर करते हैं उसको. जो woman pit है ना, उसका as per the height of the patient, we adjust the position of the patient. This is the woman pit. Here we have the screws, so that we can pull the heighted patients के लिए ऊपर लेते हैं. थोड़ा patient height कम हो तो नीचे दबाते हैं. So, what is the age limit for woman? Again, PGs. Grantokta. Sharangdar. Up to 60 by Sharangdar. Practically, as per my experience, above 50, nowadays I am avoiding the procedures. Up to 55, I take 50 to 50, I take with the risk. Above 50, I avoid the patient. Just because of some bad experiences in my previous practice. A lot of patients don't give the proper history. They might be the hypertensive, they might be the diabetic. They don't give the proper history, and suddenly during the procedure, they get collapsed. So after 50 or 55, you should take the patient carefully. Below 12 years, don't go for the Vamana. Though the patient is coming with the lot of cough and all those things, don't go for the Vamana, because woman needs good strength of the physical strength of the stomach and esophagus, which are not yet developed in those patients. So this is the limit. Then the patients who are not willing, never go for Vamana in those patients who are not willing for the one procedures. These are the risky one from the medical legal point of also. Atisula, hey, Navajavarati Sulati Krusha is the word. Chatakshina Navajavarati Sulati Krusha. For obesity, we are generally suggesting the procedure easily. Woman karwa lo, wadan kam ho jayega. Am I right? Which is? Yes. Charak says Atisula, woman contraindicated. Why? Klesha Satwa. What happens in the Atistula patient? Chala speak udarastanaha, है ना? So udara is the visceral fat is the problem. What happens? This is the procedure. Actually, ये patient का video देखता हूँ मैं है तो this was having good belly. What happens? Abdominal muscles and the peritoneal cavity. In between them, there is a big layer of the visceral fat. What it does? It prevents the pressure which is created by the abdominal muscles to pass to the peritoneal cavity, and the patient cannot create enough pressure for the vomiting. He does the procedure, but he cannot produce the vegas. So these patients get Klamit and Shramit within just after starting the procedure, 15 to 20 minutes after starting the procedure. So in these patients, you can have complications. So don't go for the atisthula patients, or specifically you are having good belly, stomach belly. Don't go for the. I have set criteria for myself. 44 inches के आगे नहीं देना है वो. उसका belly बाकायदा चेक करता हूँ. गर्भिणी. Is it possible that we can give the procedure to गर्भिणी? पक्का? क्या लगता है आपको? होता है क्या अभी? गर्भिणी में कोई देता है? नहीं. Then why have you written? One incident was there. During my initial period, I gave Vamana to a lady, and Vamana was perfect, and everything was discussed. She came out Vamana. We did Vamana well, and after prescribing संसर्जन करवा, वो उठने लगी, and while standing up, I was just writing. While standing up, she just asked me, इससे हम दोनों को फायदा होगा ना? I was like, हम दोनों को? मैंने क्या किया? Oh, I thought she was. Oh, I thought generally, literally, I thought what I did, why I will get benefited. Then she said, नहीं, मैं बच्चे से हूँ ना. I was stuck. I was literally this is the same reaction I got. मैं ऐसे उनकी तरफ देखने लगा. मैंने कहा आपने बताया नहीं मुझे. आपने कहाँ पूछा था? She was also correct. Is it like that? For every patient you ask, are you गर्भिणी? ऐसा पूछते क्या? After that I started asking for the LMP. Always go for the patient's last menstrual days. It is the must thing. Medico-legally फंस जाएंगे. उसके हुआ कुछ नहीं. भगवान की दया से the patient was safe. 4 दिन के लिए I was in tension. क्या आता है news? But after finishing the संसर्जन, the patient came. She was it was her second month or earlier third month, so it was not apparent also, and she didn't tell also. But I was safe, and nothing happened. But it may happen to other patient. So be careful while prescribing Vamana. Always go for the history of the menstruation. Next, GID patient, don't go for the procedure. Ask the patient for the patient. A lot of patients come for with the complaints of the amla pitta. Ask the patient whether you have GID or not. Gastroesophageal reflux. Ask the patient for his what do you say? Yes, endoscopy. Most of the patients have those. I clearly deny those patients the Vamana procedure because there are the chances that esophagus may come out or stomach may come into the esophagus. Udvag rakta pitta, don't go. Why? There are the udvag rakta pitta में होता क्या है? अपर पार्ट में GI में कहीं ना कहीं ब्लीडिंग का स्पॉट रहता है ना? अल्सर रहता है. So in those patients you should avoid the procedure because it may lead to the more bleeding. Long-term steroids. Why long-term steroids in the patients, specifically in asthmatics? There are the patients who are on the long-term steroids. Why we should avoid the procedure? These are practical contraindications. Can anybody have the experience of the patients with long-term steroids? What is the side effect of the steroids? One is the weight gain, obesity, swelling, edema, and osteoporosis or hypertension, or long-term steroids create the gastroduodenal ulcers or esophageal ulcer. They have that history. The patient may not tell you, or it may not have appeared before that, but there are the chances that those patients are having ulcers throughout their GIT. So these patients are avoided. Next slide, please. Cardiac patients. I have given the Vamana to the bypass patient also, but with the 3 of my colleagues were present. So all of us jointly gave the Vamana to the bypass patient. On the insistence of the patient, not from my side. He was, मुझे लेना है तो ठीक है, मेरे पास भी एक्सपीरियंस जमा हो जाता है. ठीक है, मैंने कहा लेना है, कंसेंट लिख के दे. पूरा लिख दिया उसने बाकायदा, मजा जीवाचे मराठी में लिख दिया कि मेरे जिंदगी में कुछ हो गया, आई विल द रिस्पांसिबल. ओके भाई, चलो कोई बात नहीं. मैंने 2 मेरे कंसल्टेंट और बुला लिए, हम तीनों मिला के we give the Vamana, but don't dare those things. Uncontrolled hypertension, underweight diabetics, IDDM, don't go Vamana in those patients because stress increases the sugar level. The patient may land up in the severe hyperglycemic coma. The patients who have undergone the thoracic and abdominal surgeries in recent past. I have limited myself for the six months. 6 महीने में अगर कोई सर्जरी की होगी abdominal or thoracic, we generally don't recommend Vamana in those patients. Very thin and weak patients. Those who are not having enough physical strength don't go Vamana in those patients. Then Udavarta, Mutragat, students preparing, they don't follow the any rules and regulations, and they have the tendency of ulcers. I have seen the patients. I have given the woman to these students. They miss a lot of students. Show the Jivadanam. So generally, no, it's there. Vyayam Maitunadhyana Chinta. It's there in the Sanhitas. That's why I'm mentioning Adhyana Chinta. आप लोग बहुत चिंता करते हो ना अध्ययन की. So अगर एग्जाम गोइंग पीरियड हो तो नहीं देना है. Next slide, please. So now we move. These are the contradiction. Now we will move to this standardization process. Next. So this is the process. This is the sutra from where I got this idea of doing the process of doing the standardization of Vamana process. जगन्य मध्ये प्रवृत्तु वेगाश्च चत्वारिष्टा वमना षडेष्टो दशयुते द्वित्रिगुणा विरेके प्रशस्तता द्विति चतुर्गुणश्च पित्तान्तमिष्टं वमनं विरेकात् अदं कपान्तं च विरेकमहु द्वित्रांश विट्कान् अपनीय वेगान् मेव विरेके वमने तु पितम्. For Panchakarma pages, especially, I always proudly say, we are unique. Ours is the only department which can demonstrate the Ayurveda world of the doshas. Alright? This is the only place in whole text, in all the text or in Ayurveda, where you can literally show the presence of kapha and pitta. Am I right? आपको जब भी पूछा जाता है कि whenever you are asked, वात पित्त कफ देखा है क्या? At least Panchakarma people can say, हाँ, we have seen the pitta or kapha. Am I right or wrong? Yes, we are the people who can demonstrate the world what is pitta and what is kapha. Vata is the amurto. So nobody can show the vata. It should be pursued. But pitta and kapha, we can show. So when I was in your age, UG, so I was always having the one concept, weird concept. यार ये अगर if possible हुआ, if it is possible, it is said that in the during Vamana process, what they kramat kapha pitta right? So if I can take the vomiters and go into the patholab and ask them to check what is in it, they can give me the parallels of the kapha and pitta, because Charka says kapha and pitta are coming out from the Vamana procedure. Am I right? Am I a good concept? Don't you think कि ये अच्छा concept है? यार मैं अगर वोमिटर्स को लेके जाऊंगा और लैब वाले को दूंगा तो उसने मुझे बताना चाहिए इसमें क्या है, कफ और पित्त ये बायोकेमिकल रीजन से, ये बायोकेमिकल पैरामीटर्स है, and I will from their karmas I will correlate them with the kapha and pitta, and I will have some idea of the kapha and pitta throughout the body. Am I right? That was the basic concept of going for the Vamana procedure for my PG work. Then I started working on it. Yeah, अगर मुझे खोजना है तो I should do something. Then we visited a lot of pathologists, a lot of pharmacologists, biochemists, and to my surprise, in modern physiology or in modern pathology, there is no such standard procedure where we can test the vomiters, because for any pathological finding or for any pathological physiological finding, you need the reagents. Then they check the chemical composition, reaction, and they say that this is the quantity. So that was not possible. Then what to do? So we started working on it, and we have some biochemical analysis of the vomiters at the end. I will show you that. but that was the primary idea of standardizing the procedure. Next slide, please. So these are the 4 procedures. That sutra. Next, previously, please. This sutra indicates some things, some particular things. Jaganna madhya pravritu vega chatvarishta une षडोष्ट 4, 6, 8 जगन्य मध्य and प्रवर. ठीक है, वैदिकी शुद्धि. दशे विके द्वित्रिगुणक विरेके विरेचन 10, 10, 20 and 30 जगन्य मध्य and प्रवर. प्रस्थस्थतादिति चतुर्गुणश्च 1, 1.5 and 2 for the Vamana, 2, 3, 4 for Virechana, Pittantam Ishtam Vamanam, Virikatardam Kapantam. For the good procedure of Vamana, Vamana should be Pittanta and Virechana should be Kapanta. We call them as Chakrapani, and Dallana has discussed the whole thing in an elaborated manner and said and telling that these are the slide, please. What is the purpose of these 4 criteria? What do you think? Why these 4 criteria are there to assess the process of Vamana? What is the key criteria? When it should be seen? What is the key? 4, 4. कब देखना है? 1, 1.5, 2 प्रश्न कब करना है? अच्छा 4 वेग आ गए, बंद कर दे. ऐसा? अरे एक प्रश्न हो गया अभी, बंद करो प्रोसीजर. ऐसा है? नहीं, फिर क्यों दिया है? कब देखना है? During procedure, what we observe? How many UG people have observed the Vamana process? कितने लोगों ने अटेंड किया है? अटेंड किया, देखा है? तो देखा तो होगा ना, पटके मारूंगा. अच्छा ठीक है. Which is okay. So during procedure, what is your target? Right. So during procedure, what we are continuously doing? We are targeting for the end of the procedure. We just want to continue the procedure till the end when the pitta is coming out. That's it. We are having the soul concept. कितना अरे यार कितना आया नहीं, पित्ता आया है यार. So during the procedure, we concentrate on the antiplatelet. Then why Vaikiki and Maniki are necessary? Very good. So during Vamana process, Antiki Shuddhi is important. At the end of the Vamana process, Maniki and Vaikiki. And for the treatment purpose, you have to consider कितना दोष बाहर आ गया, कितना दुष्पार्श्वमूलेन्द्रिय मार्ग शुद्धि, and everything is okay or not. For that purpose, you go for the Laigiki Shuddhi. Next slide, please. So first, we will go for the Vaigiki criteria. How to decide what should be said, what should be identified as Vega, and what should be identified as Upavega. Next slide, please. During Vamana, Charka has asked you to follow the counting number of the Vegas, signs and symptoms present, and quantity of each Vega. हम लोग जो वमन करवाते हैं तो हम लोग क्या देखते हैं? उल्टी देखते हैं ना. वो प्रोसीजर पेशेंट आता है और आपके सामने उल्टी करता है, ये देखते हैं ना आप लोग. उसके साथ क्या देखते हो और क्या क्या देखते हैं? What the other signs and symptoms you observe or ask the patient. Okay, next slide please. When I used to attend the procedure with my senior used to say, this is Vega. Okay, great. Am I right, Vijay? Yes. फिर से पेशेंट उल्टी करता है. सर वेगा? नहीं. So what is our criteria? What is our criteria to identify the Vega? Seniors nod. Na. Alright? So there is no standardized procedure to identify the Vega and Upavega. किसको वेग बोलना है और किसको उपवेग बोलना है, इसका कोई स्टैंडर्ड पैरामीटर है आपके पास? नहीं. I tried it. Yes, I tried it. Yes, force. Next slide. No, previous slide. So this is the definition. Sukha tagata prapto vegati uchyate. bout which is expelled comfortably should be identified as a Vega as per Ashtanga Sangraha. But there is a lot of confusion whether to how to decide the Vega and Upavega. Next slide. So the first, किसको वेग बोलते हैं? Sure shot, जिसमें बहुत बाहर आता है ना? The quantity is the prime criteria. The bout which is coming out with a lot of quantity can be identified as a Vega unanimously. हाँ यार ये Vega है, am I right? So the quantity is the first thing. अच्छा, कितना आना चाहिए? कभी काउंट किया है? नहीं? यहां से आगे काउंट करोगे. I have the videos. I'll show you. We carry out the procedure of Vamana to drag to expel the doshas outside the body. Am I correct? Right? To expel the doshas outside the body through the way of the procedure. So what happens? You give something for the Akantapana, you give something for the Vamana you administer. A lot of doshas, it is expected the doshas will be mixed into that Vamanopagdravya and it will come out. Is it okay? Am I talking right? Correct? Doshas are coming mixed with the Vamanopagdravya through the vomiters. ये ठीक है ना? So the input जो दे रहे हो उससे वो ज्यादा आना चाहिए. ऐसा लॉजिकल लग रहा है? Logically, can I say that whatever you are putting inside, the bout should come extra with that, extra something, extra added, quantity added into that, and it should come out. Is it okay? So Vega must contain the quantity which is administered by you. Approximately 250 to 300 the glass which we administer to the patient. And whenever the patient expels that bout, it should be more than that. So primarily we thought that it should be 300 or 350. Next slide please. Then comes the force. Now coming to the force. How to count the force? Force को कैसे count करें? Okay. So I dissected the process of the vomiting. I observed that some bouts are coming from the mouth. पीता है, वही पे डालता है. Correct? Some bouts are like he has completed first glass, second glass he is taking, and immediately it is coming out. It has not reached to the stomach, and it is coming out in between. So that was from esophagus. Third bout, पूरा glass पिया, थोड़ा 5 seconds passed. That means it reached to the stomach, and then it is coming out from stomach. Third organ, and at the end, how many PGs have seen dark, greenish, yellowish pitta coming out? Have you seen it? What do you think? From where it is coming out? Gallbladder. Okay. Directly gallbladder or through duodenum, na? So fourth is the duodenum. These are the 4 organs which are involved during the Vamana process. Am I right? Yujit? सो गए? अरे जागो. Mouth, esophagus, stomach, and duodenum. Next slide, please. So the vomiters, if it is spoiled through the mouth, I will say 1 plus. If it is coming from the esophagus, halfly, पिया और तुरंत आ गया, that is 2 plus. If it is coming from the stomach, that is 3 plus. And if it is coming from the duodenum, then it is 4 plus. Next slide, please. So every bout which is coming out, you should identify as a 1 plus, 2 plus, 3 plus, or 4 plus. And last one is the time. ये हाथ में लेके कभी आपने कैलकुलेट किया है टाइम? स्टॉप वॉच लेके how much time it takes for any bout to come out. It is generally 5 to 6 seconds. Sometimes the patient starts expelling the bout out and it goes beyond 5 to 6 seconds. You see, अरे कितना उल्टी कर रहा है, अरे रुक रुक रुक, होता है ऐसा पीजीज. हाँ, the bout takes a more time than the usual and then you identify यार इसको वही बोल सकते हैं या नहीं यार, quantity नहीं लग रहा है लेकिन time is more. So if the bout is coming more than 5 to 6 seconds, it should be counted as a vega, and if it is lesser than that, you can say is as a upavega. Next slide, please. Then I developed this bout index QFT pattern. Bout should fulfill any of these two or all the three criteria to be called as vega. Out of these three, any two criteria are fulfilled, you can say it is a vega without asking to your senior. Next slide, please. So, quantity of dometers expelled less than 300, 0, more than equal to or more than 2. Upavega, the bout is defined as upavega when the bout index is less than 2. अगर 200 ml का आ रहा है, तो though it is coming from the stomach 3 plus है, लेकिन quantity कम है और 200 को ज्यादा डालने के लिए ज्यादा टाइम नहीं लगता, हार्डली वॉक करके देखता है, वो गिलास भर जाता है, right? So this is the simplest way in which you can identify the vega as a vega and upavega as a upavega. Next slide, please. So total number of the vegas, upavegas and input. मेरे पास बहुत डेटा है उसमें क्या मैंने कुछ ज्यादा नहीं उठाया. 35 पेशेंट्स का एनालिसिस किया. नेक्स्ट स्लाइड. सो दीज आर द 35 पेशेंट्स. नंबर ऑफ वेगास अप्रोक्सीमेटली. चलो अभी हम लोगों ने ये पैरामीटर लेके हम लोगों ने वेग और उपवेग नॉमेनक्लेट करते गए एंड व्हाट वी फाउंड वाज दिस थिंग. I will ask you some लॉजिकल क्वेश्चन. 4, 6, 8 ये आंकड़ा कहां से आया? 10, 20 नहीं. Why 4? Why 6? Why 8? Why not 2, 4, 6? Why not 8, 10, 12? What do you think? What might be the logic? Which ये तो यूजी भी बता सकता है. What might be the logic? चलो मैं थोड़ा सा आपसे शेयर करता हूँ. Whatever is written in the Samhitas, they are their practical observations. Not like that. After completing this session, I will talk about some for 2 minutes. I will talk about the Brahma Smrta Vishwaveda. We'll talk about that. After completing the session, whatever have been written in the Samhitas, everything is practical and everything is correct. So from my point of view, these are the mean values. They must have practiced lakhs of Vamanas, not thousands. आज सिर्फ आयुर्वेद नहीं है, मेडिकल पैथी भी, तब तो सिर्फ आयुर्वेद था, है ना? All the patients who are coming to the Ayurveda only. So number of quantity of Vamana, just imagine कितना होता होगा, कितना वमन करते होंगे. So out of that, they find out that these are the mean values. These are the mean values. So I went for the mean. This is the mean, and what I found 7. ज्यादा पेशेंट करूंगा ना तो 6 के आसपास आएगा. So ऊपर 2 नीचे 2. And this was based on the observations. कि जिनका 4 हुआ है उनके लक्षण क्या? What are the लक्षण? Whether the शुद्धि लक्षण are मध्यम और प्रवर. 8 हुए तो उनके शुद्धि लक्षण क्या है? We will talk about that also. But मुझे बताइए 8 होता है तो क्या मतलब होता है उसका? दोषास have expelled in more quantity and 4 इसका मतलब दोषास have expelled in a lesser quantity, right? And the upavegas, number of upavegas are the 33. नेक्स्ट स्लाइड प्लीज. द वेगास जिनको अच्छा सबको ये मीन था. सो व्हाट आई डिड 0 से 4 वाला एक ग्रुप बनाया, 5 6 7 वाला एक ग्रुप बनाया और 8 के ऊपर वाला एक ग्रुप बनाया. व्हाट आई फाउंड 0 to 4 15 पेशेंट्स, उनका मीन था 2, उनके उपवेग थे 32, उनका एवरेज इनपुट था 6.282 लीटर. 4 to 7 in was 5. Their average was 6. Upavegas 40. Number of Upavegas are increased now 32 to 40, and the expected outcome was or observed outcome was 11.35, and the n was 15 in the बहुवेगा. 8 वेग आए, उनका एवरेज निकला 30, 13 to Upavegas 32, and the average quantity output was 14.47. This is the very small data, 35 patients. If you go on increasing the number of patients, this will be more precise. So these are the observations based on the number of vegas and upavegas. So 4, 6, 8 are, from my point of view, they are the mean values based on their observations and based on their understanding of the Vedic. Next slide. No Maniki criteria. अभी जरा थोड़ा सा tricky. So how you identify Maniki criteria? 1 prastha, Hina Shuddhi, Madhyam prastha, Madhyam Shuddhi 1.5, and Uttam Shuddhi 2 prastha. Okay. So what is the interpretation of that? What is your assumption? Again, PGs. What is the assumption? How to understand it? सर उसका तो सीधा मतलब ये है कि जितना दिया उससे 1 प्रस्थ ज्यादा आया तो am I right ना? Am I right or wrong? एक प्रस्थ बाहर दोष आए हैं, 1 प्रस्थ दोष बाहर आए तो what you say? हीन शुद्धि. 1.5 प्रस्थ are coming out, you say it as a मध्यम शुद्धि. Then how you will calculate it? 1 प्रस्थ बाहर आया तो कैसे होगा? इनपुट जितना तो उसमें ऐड करना पड़ेगा ना, वो आउटपुट ज्यादा आना चाहिए, नहीं आना चाहिए, आना चाहिए. तो कितने पीजेस ने अब तक इनपुट आउटपुट काउंट किया है? व्हाट आर द ऑब्जर्वेशंस? नहीं? ओके, हियर ऑनवर्ड्स यू आर गोइंग टू काउंट इट. ठीक है? ओके. सो यूजीस बहुत सारे सो रहे यार, प्लीज जागो. ओके, व्हाट डू यू थिंक physiologically how you understand it? Physiologically how you understand it? I will ask you some questions. Whenever you are putting inside, what happens in the stomach and in duodenum and mouth? A lot of secretions are added into it, right? Okay. Only secretions are there. सिर्फ body से आएगा, body में नहीं आएगा. What do you think? You are continuing the process for almost 1 मुहूर्त, है ना? 45 मिनट्स तक चलता है वो, 30 to 45 मिनट्स तक चलता है on an average till the pitanta. So during that period you are pouring so much of quantity, and what do you think? Body is not getting to accept it, absorb it. Absorption होगा या नहीं होगा? Yes, there are the chances. Then what is the meaning of that? One day, sorry. What is the meaning of 1, 1.5 and 2 prasthas? Okay. So it is difficult to count it. So I was having this major problem regarding counting of the Maniki criteria or identifying the Maniki criteria. So there were 3 options. Calculating the, so in a 3 way I edited it. Calculating the input and output, and directly mathematically subtracting input from the output was the first one. Was I correct? Am I correct? Primarily we should do it. Okay, that was one. Then what my observation is, generally whatever you are putting, and with documents I am talking now, because मेरे यहाँ पे it's mandatory to, जब से मैंने 20-25 साल हो गए, I'm practicing for 25 years. Every Vamana I have counted before and I have counted after also. Every Vamana. मेरे पास एक भी Vamana ऐसा नहीं है जिसमें मैंने counting नहीं किया है. So I have found very less number of patients who are experiencing more quantity than inside. मैंने 10 लीटर दिया है तो 11 लीटर या 10 लीटर 250 ml वो भी नहीं आता. It is always 9 liter, 9.5 liter, 8 liter, 8.5 liter, or exactly 10 liter plus minus. Bus 100 ml इधर उधर. So maximum times what I found, it is the exact quantity or lesser quantity. And the third one was my dream. मानी की है ना, quantity करना है ना, तो मैं उठा के मैंने पैथोलॉजी लैब में जाके दे दी. Then for me, B. Ravi Shankar sir, you must have heard the name. Ravi Shankar sir, he was the head of the biochemistry department in Jamnagar. So he found some methods to analyze the vomiters, and I will share my observations. After that, I didn't carry on those procedures because no other pathology is able to do that. So in Jamnagar, it was possible. So that was the third criteria which I adopted for the Maniki criteria. Next slide, please. So this is my woman pit. This is what I was talking about. That should be ये नीचे पैर डाल के बैठता है और उसका size I can adjust the procedure. This is the measuring jar. This is the vessel with which we count each and every vega. This is a vessel having the handle. I have made it like that, and then we count every bout. हम लोग जो आता है वो इसमें collect करता है. This आपके जैसा UG वाला है वो. Or intern. He counts it, he pours it, we count it and we write it. Okay? So her bout, every bout you can count, every bout you can observe also. Next slide please. इसके videos है, I will search it. So this is the procedure, this is bucket, this is the vessel, this is the measuring jar. वो बाजू में pH strips है, which we'll talk during the Antiki criteria. Next slide please. So problem, humors जो doshas है वो coming out, and you cannot separate them from each other. ये second point. Next slide please. Next slide please. Already I have talked about it. Solution. 3 solutions I found. Next slide please. Next slide please. What I did for the first one, एक डेढ़ दो प्रश्न का थोड़ा सा मुझे I wanted to clear it. So what I thought, I settled that vomitus. I was carrying out the procedure with the Vamana the estimable the Vamana. So what I did after completing the procedure, I settled that vomitus for the half an hour or 1 hour. Then what happened? The secretions which were in the vomiters, they float over the top, and some of the secretions were entangled with the some powder and they settled down. So I collected those superficial component and started collecting it. So viscous matter settled at the bottom of the vomiters. This is the liquid material between 2 layers of the viscous matter, and this is the upper portion. This was the try from my side. This is the expression of the pitta. Everybody must have seen it. This is the pH which we are going to discuss after. This slide हम फिर से एक बार लाएंगे, right? Next. So what I did and what I found. एक शेयर करता हूँ सबसे. आपके seniors. Okay. How many of you have seen the cover? Please. Woman procedure आप बहुत keenly देखते हो. So yes. How you identified it? How you are identifying it? It's a viscous. The patient when patient throws out, it is very sticky and it becomes a big line like in a thread and very sticky and am I right? Gel like. We call it as a after the procedure, if you stabilize the ometers, those things float over the top of the uh, tub. You just collect it, put it in a jar, and count it, if possible. But for that, don't go for milk and don't go for yawab also. Go for plain kashaya, because it is not possible. Milk और ये होगा तो उसमें नहीं होगा. एक बार करके देखिएगा what happens. लेकिन एक 7 8 10 15 20 पेशेंट में करके देखिएगा. It will definitely vary from patient to patient also, because depending on the nature of the koshta, nature of the prakriti, nature of the season and nature of the valley also. दोष कितने हैं उसके हिसाब से भी बदलता रहेगा. But that gives you a better idea. What I found, next slide please. Hina, Madhyam and Pravar Shuddhi, 540 ml is the one prastha from Panchakarma point of view. As per Dallar and Sharangar, not 640. 540 is the standard. So, 2 prastha is the 1080, Madhyam 1.5 prastha 810, and 1 prastha is the 540 ml. Am I right? And again I repeat, this is from my point of view, it's a mean. कभी exact वैसे के वैसे आने वाला है? होगा ऐसा कभी? What do you think? UGs? एक प्रश्न काउंट करके 1 ग्राम इधर नहीं उधर नहीं ऐसा होना है? नहीं होता ना? Then what it might be? It might be range. So range from statistical mean was 940 to 1215, 675 to 940 for Madhyam Shuddhi, and 405 to 675 is the range, statistical range for the Hina Shuddhi. Next slide, please. And these were my observations. I collected this thing in 29 patients. Viscous matter in ml was 538.5 ml. It was absolutely 540. This was the range which I found, and it is genuine. इसमें कोई भी manipulation नहीं, एक ml का manipulation नहीं. This was what I found. This was exactly 1%. This is mean again. 29 patients का mean है. इसका मतलब कुछ patient में ज़्यादा था, कुछ patient में कम था, right? So कफ पित्त जब प्रकृति people 500 ml एक ही था. पित्त कफज का mean था 540 ml. कफ वातज का 404. वात कफज वाले का 733. 3 patient था, उसका mean ही निकला. पित्त वातज 580 and वात पित्तज 540. These were the observed values from my side, and I got the quantity around 540 ml. So if you observe keenly, you can have these values. Next slide, please. Next. Okay. Now talking to the second criteria, input versus output. आपको observation क्या है? PG again. Count करके देखिए. You will always found something less. तो woman अच्छा हुआ या बुरा हुआ? How I will decide? So जितना दिया है एटलीस्ट उतना निकलना चाहिए. Am I right? जितना दिया उतना निकलना चाहिए ना, कि ज्यादा रहना चाहिए? नहीं, उतना बाहर निकलना चाहिए. That should be come out ना. Whatever you have administered, that should solely come out of the body. So I find the proportion. This is the volume inside divided by volume input into 100. This is the ratio. Percentage में जितना दिया है उसका कितना बचा हुआ है. Next slide, please. I call it as the Manikish index. I will give you an example. There are the 2 patients. In one patient, I give the input of the 4960. These are the original patients. And it was Ayoga. And 2780 was the volume remaining inside. ठीक है? एक patient आया, उसने 5 लीटर पिया और फिर बोला मुझे नहीं करना हुआ. And he refused to do the procedure. उसका 2 लीटर या 2.25 लीटर बाहर आया and इतना अमाउंट अंदर आया. ठीक है? Next patient. Next slide, please. And the second patient who came and I administered 14 liters and 800 ml into to that patient, and उसका अमाउंट रहा पेट में 2250. 14.5 दिया, 13 13.5 के आसपास बाहर जब आया तब काउंट किया, उसमें भी 2 लीटर है और उसमें भी 2 लीटर है. ठीक है ना? दोनों का रेंज कितना है? Both are having volume around 2 liters inside. So which is better, woman? Which is better? ये वाला हुआ. The proportion is lesser in this patient. 14,800 के प्रोपोर्शन में ये क्वांटिटी और 5 लीटर के प्रोपोर्शन में वो क्वांटिटी. So its MSI is 15.20 and its MI is 56. MSI is 56.04. So lesser the MSI, मानी की शुद्ध इंडेक्स, better the woman. जितना आप दे रहे हैं उतना, जितना आप बाहर निकालोगे, that will be the better woman. Got my point? 10 लीटर दिया है तो you should try for 9 लीटर, at least 10% के नीचे ही रहना चाहिए. It's my practical observation. Whatever you are putting inside, that should be you. It's your responsibility to check it out. जब तक woman तब तक मत रोको, काउंट करते रहो कितना दिया है, and always try to get it out everything. जब तक नहीं आता तब तक प्रोसीजर कंटिन्यू करो. That will produce the better results. Next slide please. This is Manik Shuddhi index. So Manik Shuddhi index is inversely proportional to the nature of the Manik Shuddhi. जितना Manik Shuddhi index कम, उतना woman की शुद्धि ज्यादा. Last ये इसका Manik Shuddhi का third point. Next slide. छोड़ दो. Next. Yeah. Previous slide. And this is the third quantitative analysis. This was my dream actually. Abhi bhi I believe it. I am dreaming of a Ayurveda pathology lab. I will share the concept. Pandu pitta pradhan hai, pitta prokop hua, and panchakarma should be done in the Bahu dosha avastha. Am I right? Bahu is the quantitative word. Bahu and Lagu are indicating the quantity. So Bahu means what? In how much quantity kapha is raised, in how much quantity pitta is raised, and in how much quantity vata is raised. We should have some quantification for that. It's a far from practicability, but I'm dreaming of that. Someday, from the whenever we will analyze all the biochemical metabolites in the body, and we'll find out the karmas of all those bodies, all those metabolites, and we will compare them with the kapha and pitta, and those same things we will identify in the vomitus and feces. We may have the idea of the kapha and pitta inside the body. This is my understanding of the panchakarma and the Ayurveda physiology. So we try to find total proteins, glucose and hexosamine. It has no dosha meaning. These were the simplest procedure which my co-guide respected Dr. Ravi Shankar found in British Medical Journal of British Medical BMJ, and we implemented that in my thesis. Next slide. So these were the average in 17 patients. We were able to do that. These are the mean values. Average values of the hexosamine, this, average value of the glucose, this, and average value of the protein, this. Next slide. So this was the second criteria. And now coming to the last criteria. I'm asking a practical question. Which is, during the procedure, if a dumb and deaf patient comes to you and is a patient of the psoriasis, a patient who is dumb and deaf, जो बोल नहीं सक रहा है और जो उसको psoriasis है, yeah? And you are going for Vamana in that patient, how you will ask the questions related to the Pittanta? Every time, do you get the Pittanta one? Exactly? No. Then how you identify it's a now Pitta is. You are the test of the test. You are the signs and symptoms. You having the Kantadaha, Udardaha, right? And the patient is not able to listen to also and not speak also, not speaking also. Then how you identify it? Okay. Some patients are unable to identify the test also. How we can identify the Pittanta if the Pitta is not getting expelled out? ओके, चलो और एक पूछता हूं आपको. मुझे बताइए आपकी पित्त के बारे में कॉन्सेप्ट क्या है शरीर में. व्हाट इज योर कॉन्सेप्ट रिगार्डिंग द पित्त? व्हाट माइट बी द नेचर ऑफ द पित्त? एसिडिक, बिकॉज इट्स रियल. एम आई करेक्ट? पक्का? हाँ, दैट्स व्हाई आई एम आस्किंग यू. Bile? Bile salts. Are they? Pitta. Okay. And hydrochloric acid? These are the questions which we should be able to answer. That's why I always say, yesterday also I was talking, Ayurvedic physiology and modern physiology, Ayurvedic anatomy and modern anatomy are don't mix every time with each other. Please sit down, please. Thank you. She is correct. That's what my answer is. Pitta is neither alkali or nor acidic. Pitta is acidic and alkaline also. It's my article. It's only an article. It's my article. Huh? Because, no, it's not sorry. It's not sorry. It's my article and what I want to share to you. मैं कल भी यही बात कर रहा था. Please listen to me. Listen to me. हम लोग presume करके बैठते हैं. We presume something. We assume something. We prejudice our mind. We are prejudicing Ayurveda by putting modern things into it. Whether Charka has said Pitta is alkaline, then why we are saying Pitta is alkaline? We ourselves are assuming it Pitta acidic hoga. Am I right? Don't label anything to it from modern physiological aspect, right? Please, next slide. What we did. This is a sutra, very popular sutra. Kramat kapapittamataani lasya yasyeti samyak bhavita seshta utparshamo indriya marga shuddha तथा लघुत्वे अपि च लक्ष्यमाणे ये क्रमात् कफपित्तमथानि लश्च क्रम से पहले कफ आना चाहिए बाद में पित्त आना चाहिए नेक्स्ट स्लाइड प्लीज इसके अलावा देयर आर टू अदर आचार्यस even in Charka also woman ka whenever you are carrying out the procedure of Vamana there is not every time it is not possible that you will find the signs and symptoms of the pitta. Am I right or wrong? Most of the यावत् कफच्छेदस्य the target of the Vamana procedure is to expel kapha. Once kapha is getting out and you are observing that there is no further expulsion of kapha, only whatever you are giving as a medicine, it is only coming out. What does that mean? Kapha is finished. Now kevalam aushadha pravritti. So that time also you can stop the procedure. Next slide, please. One second. Hindu said, यावत् प्रथममेव कफः क्षीणः तावत् यत्नेन अंगुल्यादिना छर्दयेत् अथवा कफच्छेदानन्तरं केवल औषधप्रवृत्तिदर्शनं यावत् अथवा ततोपि अनन्तरं यावत् पित्तदर्शनम् एतच्च व्याध्यादि बलापेक्षया. Next slide, please. This is Charak. Charak has given the 4 criteria. काले प्रवृत्तिः अनतिमति व्यथा यथाक्रमं दोषहरणं स्वयं च अवस्थानम्. काले प्रवृत्ति क्रमात् कफपित्तम है ना प्रॉपर इन अ प्रॉपर सीक्वेंस. अनतिमति व्यथा the whole procedure should be comfortable. Once the patient starts exerting, exhausting, you should stop the procedure. You cannot stretch the procedure beyond its limit, physical limit. Third, yathakramam dosharanam swayam chavasthanam. Or sometimes what happens? You ask the patient to take the glasses. He takes 4 glass, 5 glass, 6 glass, 7 glass, and he is not able to, or she is not able to expel it out. The procedure from her body is completely stopped. Swayam chavasthanam. on the body itself, the body has given up. It is not reacting to your stimulus. That time you need to stop the procedure. Enough has been done. Enough doshas are expelled out. Next slide. Yoga lakshana bhavati. Next slide. So vomiting should be allowed. Timely expulsion of the doshas with least or no pain during the procedure. Sequential removal of the dosha and involuntary sedation of the vomiting process. Next. So this is data of only 38 patients. Again, Pitta Darshana was observed in 8 patients. These are the various signs and symptoms at the end where we stop the procedure. Tikta Seta was observed in 12 patients. Katwa Seta was expressed by 1 patient. Amla Seta was expressed by 2 patients. Visragandat was present in 30 patients. Atisveda Proti was present in 11 patients. Kantada was present in 1 patient. And Svanchavastana was 6 patients. These are the Pitta Lakshanas which are present at the end of the procedure. On the basis of these observations, we stop the process. नहीं अभी इसका पित्त आने लगा है, कफ खत्म हो गया है, we should stop the procedure. Next step. Now coming to the experiment. So milk and yava are having the pH the neutral. Water, normal tap water is having the neutral pH. What I started using pH paper. I showed that strip to you people. है ना? एक pH का ये आता है, strip आता है. उसमें range होती है. 3 starting from 3 or 4 up to 11 or 12. This is the range. This is the color. 2, 4, 6, 7, 8, 9, 10, 11. And अभी तो उसकी भी आगे की वजन आती है. 3 भी आता है, 5 भी आता है. 7, 8, 9, 10 रहता है उसमें. This is the pH strip. These are the pH strips and this is the marker. ये pH paper होते हैं. आप लोगों ने you must have used it in element 1 to check the pH. So every time whenever the bout is coming out, we are counting the pH of that bout. And based on that, we have some observations. Next slide, please. These are the observations. What happens when you start the process? Physiologically क्या होता है? तो initially HCl secrete होता है बहुत सारा and it starts coming out. Along with that, what happens? Along with that क्या दिखता है? Please. बहुत सारा mucus secretion आता है ना? जिसको आप लोग कफ आया कहते हैं ना? What is that? Mucus. A lot of mucus is being secreted from the body. I will tell you why. Okay. So initially it might be the acidic in some patients due to the influx of the acid in the stomach followed by the alkaline pH. Alkaline pH in the initial phase is due to the influx of the mucus secretions. pH remains around 7 for that procedure. At the end again it comes alkaline due to the involvement of the bilirubin or the secretions from the duodenum. This phenomena was well understood by Chakrapani. Okay. But रेफरेंस शेयर करना चाहूंगा. तो क्रमात कबाब इतना मथा नहीं रहता ना. ओके. सो HCl आता है. HCl आता है. आता होगा ना. पक्का. ओके. उसका टेस्ट कैसा होगा? अम्ल. ओके. व्हाट इज द टेस्ट ऑफ प्राकृत पित्त? चरक सूत्रस्थान 58 1/58. Amlam Kadumcha. So it mimics with the HCl. चलता? पक्का? अच्छा. तो फिर पित्त आने लगा तो रुकवा दो ना procedure. Why are not stopping the procedure? Whenever the patient is saying that मेरा मुंह में खट्टा खट्टा आ गया है, why we are not stopping the procedure? Why we ask the patient or why we wait till the तिक्तास्यता जबकि ग्रंथों में कहीं पे नहीं है. अनिला pardon? Anil Udgar? I don't understand. Anilasya na. Why we wait till the tiktasyata? Why we not end our procedure when HCl starts coming out? Because it is also pitta. Okay, what is pachak pitta? As per our understanding, broad understanding, broad. I'm not claiming it, and I don't agree it also. But what is generally it is understood as HCl. Am I right? HCl ना broadly मैं पक्का नहीं पूछता एकदम वही ऐसा नहीं है HCl पकड़ते हम लोग पांच पित्त ओके व्हाट इज रंजक पित्त see what I am telling you there are two pittas in the Amasya region. There are two pittas. That's why I'm asking you the references. And it was very well observed by Chakrapani. I will drag your attention to a beautiful sutra, beautiful explanation by Chakrapani. Please next slide. क्रमादित्यनेन वचनेन यथोक्तक्रमलङ्घनेन कफादि आगमनं न सम्यक् योग लक्षणमिति दर्शयति यतः कफात् ऊर्ध्वं गतं यदा पित्तं भवति तदा तु अपि पित्तगमने अपि सति न शुद्धिः किन्तु यदैव आमाशे अधोभागगतं पित्तं वमनम् आनयति तदेव शुद्धिः तत् पित्त आनयनं च कफ आनयनान्तरमेव. I think it speaks a volume. इसका मतलब क्या हुआ? ये चक्रपाणी बोल रहा है नहीं 1000 years back. He's saying जब वमन करवाते हो तो कफ के बाद पित्त आने का जो सूत्र है तो पित्त शुरू में आने लगता है because in आमाशय पित्त is present. So obviously it is coming out. But we should not stop our procedure when that pitta starts coming out. We should stop the procedure when the pitta which is located in the adhoamashay starts coming out. Then only we should stop the procedure, and then you should consider that now kapha, the expulsion of kapha has been stopped, and the pitta is following kapha now. That is pittantam. And this adho amashayagatam pittam, whenever it is coming out, it is always typical pitava haritava varni. Am I right or wrong? With the visragandha, with the viscous. उसका अगर आपने कंसिस्टेंसी देखा होगा ना, पित्तम सस्नेह तीक्ष्णोष्णम ना, तो जो सस्नेहता होती है ना, the bile which is coming out is typical greenish yellow, viscous, and with a lot of bad smell, foul smell, right? It's very typical visragandha. Whenever it is coming out, you should stop the process. Why I'm talking about it? Because there lies my answer. Next slide. This is the pitta. ये सब लोगों ने देखा है येलो कलर का, डार्क येलो कलर का. Which is again this yellow color. The pH is around 9. This is the pH of that pitta. The pH of bile is 9 or around above 9. The pH of HCl is 4 to 6. So when you are carrying out the process, whenever the patient is complaining of the amlata, you check the pH, you will find the pH around 6. So during the initial process, when the process is continuing on, the pH roams around 5, 6 or 7. Around 7 वो continue चलता रहता है. When the process starts coming towards end, it always move towards 8, and when absolute pitta comes out, it always go 9 or dark blue, 10.5. So this is the clear marker of the Antiki Shuddhi. If you are observing the pH of every procedure keenly, you will find these observations. So during the procedure, it always remains around 7, and towards end it becomes the alkaline. So it shows that pitta has started. Though patient might be unable to tell the taste of the mouth or the other symptoms, you can say that now enough kapha is expelled out and you can stop the procedure. So this is the Antiki Shuddhi. Next slide, please. So in range of the pH, when we stop the procedure, the pH, one patient was having pH 5 to 6, 6 to 7, 8 patient, 7 to 8, 17, 8 to 9, 22, 9 to 10, 6 patients. Next slide, please. So endpoint of the Vamana, the maximum patients end Vamana with the pH level around 8 or more. This is the conclusion. So now coming to the conclusion, last slide. Process standardization of Vamana process is very much possible. Vaigiki criteria or bout index provides a clear-cut distinction between Vega and Upavega. Maniki criteria in terms of the quantity of expelled material and comparing it with the metabolites is still far from reality, but Maniki Shuddhi index provides more practical picture about outcome of the Vamana process. Mucus secretions collected during Vamana process. Antiki criteria with pH paper is the best parameter to seize the Vamana process, irrespective of signs and symptoms present at the end of the process. And Leggy criteria is solely to be decided based on the signs and symptoms of the disease expressed signs and symptoms during Vamana process. Next slide. So thank you very much for patient listening to me, and I again thank Tarnath Ayurvedic Medical College Principal Shida sir, respected HOD Rajesh Subur sir, and Kenanma sir for super achievement. Thank you very much. So the session is open for answer question and answer. Thank you.
Session is open for question and answer. Please raise your hand for the questions.
This was the completely new concept. This was completely new concept. I am practicing at least Vaigiki criteria, Maniki criteria ka input or output measurement, and pH. I am using since 25 years, and this is. I can assure you that if you follow these procedures, the confusion between Vega and Upavega will be clear, and pH is definite criteria to identify the Antiki process. Please. चलो apart from this दूसरी कोई शंका है अभी तो चलो ये छोड़ दो. This is made for the PGs only, but चलो UG के बच्चे भी आ गए सुन लेते.
In starting, you said you stopped the procedure above the 55 years. You stopped that procedure. Sir, so what was the bad experience there?
Okay.
And how you managed it?
Okay. One of my patients, what happened? Sometimes we are unable to analyze or predict the outcome of the procedure. I gave the woman to a patient aged around 60 years, and the patient got stroke on the same day, on the next day. I don't know whether it was related to the procedure of woman or not, but that patient was having stroke along with the raised sugar levels, which were not known to him also and not known to me also. We didn't carry out all the investigations, right? Before carrying out the woman procedure, I generally do two things: one ECG and second at least sugar levels nowadays. But in that patient, it was 20 years back or say 17 years back. So since then, I stopped giving the woman to aged people because their nature is unpredictable from my point of view. So physiologically, I cannot. If the patient is in good strength, I said, I told you, na, I given the woman to a bypass patient also, with all the precautions, with all the care, along with 3 Vaidyas, I carried out. But I rarely do nowadays. I don't want to trouble the patient also because I don't think today's legality allows me to do the experiments. So I generally don't go. we can give, but what I shared with you is my experience. From my point of view, I stopped giving the procedure, Vamana procedure, to the patients above the 55 years. It is not contraindicated. From my experience, I stopped after that because uh, maybe that age cannot tolerate the strain of the Vamana process. It's very exhaustive process.
Adu Amasa means you can say Girni, duodenum.
Hmm.
Adu Amasa means.
Adu Amashe, we can say Grani.
So during Vamana, when it means pyloric sphincter will be closed, no sir.
Okay.
So because of that pressure,
Okay.
so how it that bile become
ನಿರಣ್ಣಂ ಈಶ ಸ್ನಿಗ್ಧಂ ವಾ ಯವಾಗುಂ ಘೃತವಂತಂ ಯವಾಗು ಪಾಯತ್ವ is the initial claim or initial suggestion by Charak, right? So for initiating the Vaman process, we generally start the process with the yavagu and gruta. So what is the fat? It's a fat and carb. Whenever we give yavagu and gruta to the patient, pyloric end gets stopped. Gets closed, okay? And we carry out the procedure completely. But what happens at the end? It remains closed for 45 minutes to 50 minutes. It will not remain closed for the whole day. That's the limit. It's a stomach, na? It has its own limit. You are pouring down. That's why the patient, a lot of patients are having adhomala pravritti after the Vaman procedure or during the procedure. You must have observed it. PGs, am I right? Yes. So until and unless the pyloric sphincter gets opened, it is not possible in those patients. So pyloric sphincter, it is not a rule that pyloric sphincter will remain closed for the whole procedure. At the end of the procedure, pyloric sphincter gets opened and the bile from the duodenum comes out and it is expelled out of the body.
So while explaining Antika Shuddhi, sir, why they need to explain about Antika Shuddhi like in Vamana only Pittanta in Virechana Kapanta? As we are concentrating Vamana for only Kapana, sir.
There are two answers. Number one, it's a physiological limitation. Beyond, if you want to continue the procedure also, it is not possible to continue the procedure after that. Because getting the pitta itself exhausts the patient. You must have observed it. So the direct pratyaksha observation is that if pitta is coming out, practically it is not possible to carry out the process further. In lot of patients, we carry out the procedure. If we feel that kapha is also coming out and pitta is also coming out, we carry out the procedure for further period also. But first answer is that is the practical observation that when pitta starts coming out, antiperistaltic movements, till then, the force with which the antiperistaltic movements are going on, they get stopped. The first answer. And second answer, as we are concentrating on the expulsion of the kapha, that's why Sangraha's observations are more important. It is their observation that when pitta starts coming out, there is no further expulsion of the kapha. That's why whenever pitta starts coming out in 80 out of 100 patients, the expulsion of the kapha automatically gets stopped. That's why they must have said the Virechana should be Kapanta and Vamana should be Pittanta. In Virechana also, the sequence which they have explained, Pitta, whenever Pitta is completely exhausted, there is no Pitta is further coming out, then the Kapha starts coming out. What does that indicate? What is Kapha? How it looks like? It is mucous membrane only. So it has started scrapping the mucous membrane down now. So it may create the lesion, or further, the purpose of the Virechana is the expulsion of the pitta. So when the mucus or the kapha starts coming out, further expulsion of the pitta may not be possible. That's why they have explained these two endpoints of Vamana and Virechana respectively.
So is it necessary of assessing Kosta and acne before Vamana comes?
Yes.
So but Vamana drugs will not go under your digestion.
संग्रह का श्लोक निकाल संग्रह शायद कोष्ठ विभज्यम वाकवट शुरू में okay, let's finish this one. Let's finish this one. बहुत पहले वो जो चरक से शुद्धांगवटी सूत्र थे ना, हाँ, बस अभी स्लो अष्टांग हृदय वाला श्लोक और थोड़ा पहले और बस अष्टांग हृदय कोष्ठ विभज्य वैशिष्ट्य मात्रा मंत्र अभिमंत्रिता. Even Sushruta also in Sushruta Chikitsa 33, the explanation of the Koshta has been given for deciding the dose. So Koshta is needed, Koshta assessment is needed for assessing the dose primarily of the Vamana and Virechana medicine. If the Koshta is Krura, you need to go for the Tikshna Dravya, and if the Koshta is Mrudu, then you should go for the Mrudu Dravya. And the lesser quantity and more quantity. So in fact, Basti also, if you go through the complications, every complication has the hetu. Agar if the patient is like Alpadoshi, Guru Koshti, Rukshahar Sevi, and you go for the Tikshna Basti or you go for the Mrudu Basti, then the Basti gets stuck in the body and the Ayoga of the Neuro Basti happens. Am I right? So there also the Koshta assessment is important, because based on the nature of the Koshta, you have to decide you have to go for the selection of the drug and dose of the drug. That's most important. What do you understand by the Agni? What do you understand by Agni? That is very important. Why Agni is important? Before Vamana and Virechana and in Basti also, what we mean by Agni as a whole? Agni is the physiological status of the GIT. Agni comprises all the hormones, all the acids, all the enzymes, all the alkalis are the part of that whole, the concept of the Agni. Right? So checking the Agni or bringing that Agni at an optimum level is the most necessary thing before carrying out this vigorous process. Vamana और विरेचन क्या बच्चों की क्या चलो आज उल्टी करते हैं चलो यार बहुत दिनों में उल्टी हुई कैसा है? Is it like that? चलो यार आज 20 जुलाब कर लेते हैं यार बहुत हो ऐसा है? Is it like that? No, these are vigorous process. It's not a small thing. You are asking your GIT, you are asking the GIT of the patient to expel 20 Vegas. Routinely we are doing one or twice. We are going for defecation once or twice, and you are asking the GIT to work for 10 or 15 Vegas. It's 10 times. Is it not vigorous? And if you are going for vigorous, then try to make sure that at least before going for this vigorous process, the Agni and the nature of the Koshta should be Tikshna Agni word.
What will be the reason? I don't know, sir.
Tikshna is the good Agni. The Tikshna is adjective over there. Tikshna Agni is not the type of the Agni which we understand by that meaning. Tikshna is a good Agni, strong Agni, strength. The Agni of the strength is a good. in that patient, because all the other criteria you can go through, all the other criteria you'll find he's talking about the physical strength of the patient, right? He should have the good bala, he should have the good strength of the agni, he should have the good koshta. So in the line of that, the word Tikshna should be understood. There you cannot take the literal meaning of the Tikshna.
Not the Vishamani.
No. Not a Vishwamani. How it will be? You should understand. See, again, yesterday also I was talking. Koshta is not Koshta every time. You should understand the context. Trivida Rogmarga, the context of the Koshta is different. Abhyantara, Koshtam, Mahanimnam, Am Pakvashesti, Sa Koshta, Sa Abhyantara Rogmarga Uchate. This Koshta is different and Koshtagatwata is different and Panchalas Koshtanga is different. Everywhere the context is different. You need to understand the context, in which context that term is there.
In Samyakwanta Lakshana, Krutpashva Murdendriya Marga Shuddhi said, sir. So how we can assess the Indriya Shuddhi?
Again the same thing. We are continuously working on that. These are still, we are based on the, we are observing these symptoms only on the subjective parameter. We assess Parsha, Murda, Indriya. Indriya, 5 Indriyas, you ask, if you have observed the keenly, if the patient has the Pittantomna, always see the face of that patient. Always observe, it is beyond words. The patient is relieved, the patient gets freshened, his eyes sparkle, and ask him about the taste. He will feel very fresh, and he will say, "Muh acha hai, kadwa hai lekin acha hai." And in the evening also, he has that feeling of the freshness. So on basis of that, we can understand the subject. It's a subjective. Right now, it's subjective.
Sir, if there is no Vegas, only continuous Upavegas will be there in the procedure. Can we count those Upavegas?
We can count again. That's why I showed the number also. I showed you the number also. I'm counting the same thing, Vega and Upavega also. Because what I feel, Upavegas can vary from 10 ml to anything. Vegas, ठीक है ना, 300, 400, उसका एक लिमिट है, 4 लीटर तो नहीं आएगा कभी, है ना? We have seen 1500 ml in one Vega, but that was by maximum. Mahavegams. There is another term used in Charaka, Mahavegam. I think Sangrava Charak, somewhere in context. Vegam, Upavegan, Mahavegam. That was literally Mahavegam. The patient starts vomiting out, and the whole boat was there. So we counted it, it was around 1400 ml. So I have seen that range, but Upavega, it might be 10 ml, 15 ml, 20, 40 ml, 50 ml, and it, okay. थोड़ा सा और बोल लो, चलेगा? Are you getting bored? Yes, sir. रुको. Okay. Okay. With your due permission, whether I should. Okay. What is the difference between Vega and Upavega? Physiological. What do you think? Why Upavega was not the criteria to go for the, why Vega? Okay. Basic purpose is to expel the dosha out. What happens? Vega needs more efforts from the body. The stomach muscles, which are smooth muscles in nature, needs more pressure to expel the Vegas. That drags a lot of energy from the body, attracts a lot of blood circulation towards itself, through which there are the possibilities that doshas will be expelled more or dragged more towards the koshta. That's why Vegas are having more importance than small bouts. Small bouts don't create that much effort, that much strain, right? And that much attraction of the doshas, because this is the procedure through which we are attracting the doshas from the far distant cells towards the posture. So they need the more strength also. And through Vega, that might be the case. That might be the possible. That's why yoga might have been given the priority than Upavegas. And they are easier to identify than Upavegas.
Thank you for the presentation, and from this I have got many points. As I have taken a comparative study for my trials, and among that one of them is Vamana, and the condition for which I am giving Vamana is psoriasis itself. And I have given 20 Vamana to 20 patients. In all the cases, I have observed quantity less than the given quantity. Output is always less than the input, as I have observed. And as you told that input is we can consider
The
that-
percentage, that's why Maniki Shuddha index. That's what I always tell. As a physician, it's my duty to stop the procedure till the whole quantity is coming out. I should not send my patient to the ward or the patient to the home before he expels out the whole quantity. घर पे जाके अगर उसको उल्टी हुई बड़ी सी तो घर वाले क्या बोलेंगे? It has happened. On OPD level, sometimes we do the procedure. Every time you don't have the IPD setup at your OPDs. Am I right? So if you go for Vamana and you don't count the things, what happens? You stop the procedure, pitta aa gaya, and then you don't keep the record of input. What happens? Patient goes home. Almost 3 to 3.5 liters are there, and suddenly people at home are not aware of what has been done over there. अचानक से पेशेंट वहां पे बाबा बड़ी उल्टी कर रहा था, and then suddenly the people at home get scared. ये क्या कर रहा है? And it may land the trouble. It may the patient may land in the trouble.
Yes, sir. Among these patients, I have observed even though the quantity of output is less than the input, then also we have observed samyak shuddhi lakshanas. Even we have observed the pittanta.
That's true. That's what I'm telling you. See, Antiki Shuddhi has nothing to do with the Vedic and Maniki Shuddhi. Make it clear. Throughout presentation, have I said that Antiki should match with the Maniki? That is possible that you have the 4 Vegas and only 1 Prastha, and still you have the Pittantoma. Completion of the Vamana procedure has nothing to do with the Vega and Man. Kitna diya, kitna bahar aaya, that's a different thing. Your Vamana should be Pittanta for your for the sake of the good Vamana. जब तक पित्तांत नहीं होता तब तक वमन नहीं हुआ है या प्रोसीजर कंप्लीट नहीं हुई है. That is the only ultimate aim of the physician. So don't compare or don't correlate Vega and Mana with the Antiki Shuddhi. Antiki Shuddhi is a totally different criteria.
Yes, sir. From this lecture, I have got that point. I'm really thankful to you, sir. And my question from this is, what is the yoga which you prefer in the clinical practice usually?
Okay. I have done a Vamana with a lot of various change also, Kalpanas also. I have used Churnas, I have used Auleyas, I have used you can say decoctions, font, everything I have used. Right now what I am practicing this. चूरना वाला अवले वाला मैं तब छोड़ दिया जो हम लोग सालों से करते आ रहे हैं ना. 4 ग्राम मदनपल पाउडर, वचा I stopped using since long. I don't use Vacha because I'm working in Nagpur region. It's very hot region, so it always creates a problem. It is very irritant. What I'm practicing right now as Antanak Mushti. For myself, I have 7 to 15 ml, 7 to 15 gram soaked in 400 ml decoction of the yeast madhu. In the morning, I filter it and I use it as a Vamana. Before that, I did 15 grams of churna soaked in 4 liters of decoction, filter it, and all the 4 liter I used to give. I have done that also, right? Then before that, I was using Aulia practice, churna mixed with senda and honey, always mixing with the decoction, all those things. But previously we were using this Aulia form, sendo, honey, madanfal powder, mixing again 7 to 8 grams, madanfal pipali powder. That we were used to it. Then a carvalak yoga है madanfal में. I practice that in Madhumaya patient also. That we also use. Kurtavedani yoga also I have used. Kutaj also used. So there are so many ways you can practice. But from my point of view right now, this is the safest way in which you can carry out the procedure. Go for Yavago first, then go for the milk, then go for the Vamak yog, then about start coming, then use the Vamanopakadravya, and at the end go for the Sendojal. This is the safest practice. A lot of there are with this procedure least chances of having the complications.
From that same yoga, I have one more question. As I have for Kushta, I have selected the Panchakashaya, which is
Kutajadi Yoga. My PhD is on that. Kutajadi, Nimba, Indrayo, Patol, and Madanpal.
Yes, sir. In this yoga, I have Vacha, Vasa, Vasa, Nimba, Patola, and Falini along with Madhu and Madan.
From where? Shitapitta, Amlapitta Yoga.
Sir?
Shitapitta and Amlapitta, Vasa, Patol, and Nimba. And the बाकी दो लोग कहाँ से ने कौन से योग है?
It is from Kushta itself, sir.
Okay.
From Yoga Ratnakara and
Yoga.
Vashyadya Ratnavali.
Okay. No issues.
Actually, the yoga has 7 drugs. The name is Panchakashaya. As I have selected Kashaya Yoga, sir. Should I consider Vega still the expulsion of Kashaya or Pittanta? If Pittanta has not occurred, but expulsion of Kashaya completely done, should I count the Vega still Kashaya or Pittanta?
Yes. If you are achieved kapha cheda, if the kapha has stopped coming out of your during the procedure, जो viscous matter आता है, वो अगर आना रुक गया होगा, केवलम औषध प्रवृत्ति हुआ. If you are observing that whatever I am giving, it is only coming out, you stop the process. But again the same thing. That's why Manik Shuddha index is important. Count the proportion which is remaining inside. जितना दिया है आप लोगों ने लग रहा है कि 10 लीटर 12 लीटर गया है और आपको लग रहा है कि अभी मुझे रुकवाना है, लेकिन अंदर आपको लग रहा है कि 2 से 3 लीटर है. Continue the procedure till the volume gets at minimum level.
Initially, I have tried with milk at the initial as a Akantapana, and later on, as I came to know, there was no complication. Even if I not advise even Kshira, then I have given directly the Kashaya Yoga. Even I observed the same.
Again, I am saying that we can use my PG work was throughout Yeshimoda Kvata and Yeshimoda Fanta. Initially, also I was doing the procedure with the Kvata and Fanta only. But from the experience, I am saying that's why Vagbata must have corrected it. Vagbata has corrected it for the Sukumara, Vruddha, Bala, Biru patients. Huh? So that is from the safer point of view. You can practice by the Kasha also.
Thank you so much.
Thank you, sir, for the session. My question is around diabetes and Panchakarma. Diabetes and Panchakarma. So, like as you mentioned, for Vamana Karma. So, contraindication for Krishna Pramehi. In contraindication, you have mentioned Krishna Pramehi. So, like, what is the physiology and why you have contraindicated that, sir?
So physical strength is important for any type of patient. So Krusha patient, irrespective of diabetes, any Krusha patient, I generally don't advise the patient to undergo the Vamana process because there are the chances of Vata Prakop after that. right? Regarding the diabetics, there are the chances of hyperglycemia in these patients. Sugar level may get shoot up in those patients. As I said earlier, in that patient, the sugar was shooted up to 350. So there are the chances in diabetic patients that with with a physical pressure, like that in Vamana process, there are the chances that the sugar may go beyond our control. That's why I generally not prefer in this patient.
So, sir, is this for Vamana Pradhana Karma or Purva Karma of Sneha and Svedana also? Because during the procedure, the body is under stress, and if body is under stress, it will like steroid will produce, and again hyperglycemia can happen. So there are the chances. So like it is the only for Vamana only or other Panchakarma procedures like Virechana and Basti.
In neuropathy itself, Prama is contraindicated. Astapan. The last two contraindication are the Kushta and Prameha. In Anastapya, if you check the Siddhisan 2 chapter, Kushta and Prameha specially contraindicated for Vamana procedure. Sorry, for Astapan. In Virechana also, if the Kushta is good and Agni is good, Virechana you can go, but certainly I will suggest you to not to go for woman and neurovasthi because they are specially contraindicated.
But Madhutalika Basti is specially indicated for
Even Charasiddhisan 10, there is a basti for the Prameya. There, even in Kushta chapter, though here in Anastapya he is saying, in Kushta chapter there is an Astapan basti. There are always exceptions. We are talking about the general rule. In other patients, generally you can go for the Samanyata, you can go for woman and all those things. But in Kushta, generally, Samanyata, you should not go for the neurovasthi. Vamana you can go. In Prameya, you can go for Vamana. I'm talking about the Krusha Prameya.
yes, sir. Even I am worried about Krusha Prameya because other Prameya like hypoglycemia.
No, Charka himself has suggested, na, Sula Prameya Balwane ka, unme dena hi na. वो सूत्र, that sutra itself is saying, go for woman and which and those patients. I'm talking about the Krusha and Durbal patient. Yes, that's it.
In that case, sir, like if we need a Shodhana, if Shodhana is necessary.
Mrudu Shodhana.
So,
Just like Rajeshma. Just like Rajeshma.
So, shall we go for Mrudu Virechana or a Satya Virechana is?
Depends on the how much strain the patient is having. Again, the same thing, what you are initial talking, Snehapan ka bal wo, whether that patient can bear the strength of the Snehapan also, right? So, and again, the Svedana is contraindicated in Madhumeha, right?
So, anyways, seeing classical Panchakarma is overall indicated for Durbala and Prameya.
Yes, that is the primary thing. Strength of the patient or Bala Parikshan is the primary thing for any type of Panchakarma. If the patient is not Balavanta, everywhere, Vamyascha, Virechascha, these are the conditions. Anara mein jahan pe bhi jao, Bal, Vruddha, Durbala is the word everywhere contraindicated. Whenever the patient is Durbala, you should not put the patient for the Panchakarma. Neither Vamana, nor Virechana, nor Vasti, Astapan Vasti. All Durbala patients are contraindicated for any type of Samshuddhi.
Then what may be the Chikitsa or
Mrudu, just like Yakshma, Durbal patients, you should go for the treatment like the Yakshma only. Based on the Mrudu Shodhana. Nitya Virechana, you can go for those patients.
already though contraindicated, already we have given the Madhutalika Basti or Asapana Basti or Virechana, then patient went again Durbalata has it.
No, in those patients, it's not like that. Madhutalika Basti, they are again saying, आप एक को ही क्यों पकड़ माधुतैलिक बस्ती दी है तो उसके भी that is also having some specific indications. हर पेशेंट में नहीं देना है, क्रूशल दुर्बल पेशेंट में नहीं देना है आपको. If the patient is having the strength, if the patient is having the bala, then only you go for the basti if you want to, and if the condition allows. That's it.
Thank you very much, sir. It was a very brainstorming session. With the due permission of sir, I would like to clarify, add some more points regarding that Rashastra PG they have asked you. See, basically, as you open that Durbala and as well as Krusha patient, its general rule they are contraindicated for Basti. Though exception is there is a good means like Stula persons and as well as they are Balawan, even still they are contraindicated when they have a asamyak mana and as well as mental status. Okay. Even we have seen that the Vamana, based on their physique and as well as Agni Bala, we have posted for Vamana. On the day of Vamana itself, every patient, they will consume that Uttam Matra Snehapana, they follow do's and don'ts. On the day of Vamana itself, even while taking that Madan Phala Yoga, immediately because of the fairness of the procedure itself, the previous night they will not slept properly and they will get immediately panic tremors. To see they are very stout and very strong enough, but mentally they are weak. It is only conclusion that physical strength, mental strength is more required than the physical strength in case of the all panchakarma. This is one take home message from my side and this is my experience also.
Yes, sir.
I do agree, even sir will also accept it.
Yes, sir.
Okay. This is
सूक्ष्मानी
one point.
दोष वेशज देश काल बल शरीर आहार सत्व सात्म्य प्रकृती वैसामोस्तांतराणी. So sattva is very important in all the Panchakam procedures.
And even as you told, due to Madhutailik Basti, patient got weak and all. No chance at all. Especially because Madhutailika Basti is such a unique combination of Basti which has been told under the context of Prameya, that to Vataja Prameya. Okay, that's why Madhutaile Samak Karshat Phalam Ekasya Randava, Phalam Ekasya Madana Phalasya, like that. The unique combination of Madana Phala itself that will give instant nourishment and even that will minimizes the weakness, generalized weakness which are present in case of the Vataja Madhumaya patient. Okay, maybe that is due to what you can say, the improper doses or improper administration or mixing of the Basti Drava, that you have to rule out. Okay, because even in Madhutailik Basti, so many varieties they have been explained. Ardha Madhutailik Basti, Dashamula Madhutailik Basti, Dashamula Kshira Basti, so many varieties are there based on condition. If it is Avarna is there, then you can choose other Madhutailik Basti. If it is Niravarna is there, then you can choose. There are so many options now.
Basically, before any procedure, yesterday also I quoted that sutra, my favorite sutra, Sukshmani dosha vishaya deshikala. Before all the procedure, we should follow all these things. Whenever you are talking to the patient regarding the Panchakam, anytime if you are convincing the patient or if you are counseling the patient for any Panchakam procedure, always try to assess these all 11 parameters and then only suggest any Panchakama.
And regarding my PGs, they asked how we can assess the Indriya Shuddhi, Dura Parsha Murdendriya, Rut Parsha Murdendriya Shuddho. This is simple and what we can observe. Many times I used to tell, before practicing and before starting the Vamana, just don't forget to check the all vitals like pulse rate, respiratory rate, cardiac rate, and even the nature of the skin and their orientation. Indriya Shuddhi, it all depends on organs perceptions during the Vamana and even after Vamana and even before Vamana also. You observe Matibodu, whenever that avastha, when the Aushadhi is about to come, at that time patient won't listen any words of a PGs or physician. They are under the what you can say, Klama and as well as Glani is more in that condition. Siro, Brahmata, Gauravata and Brahma will be more. When patient is feeling that severe headache and they are unable to listen your word, then you have to think that Aushadhi Chardana is about to come. That's one clinical observation. Our PG students also they have noticed. Okay. And after, how to assess the Hridaya Shuddhi? See, if it is within the normal, what you can say, value of the cardiac rate, then it is Hridaya Shuddhi itself. If it is more than that, even, and one more observation, see, sometimes you ask Pittanta will occur and even some Shesha Aushadha, there is also possibility. Initially, Pittanta will come, means after, even in Pittanta also, two aspects. See, in first Vega, patient will vomit yellowish. Then all will think that that's an Pittanta, oh, yellowish. It's not a Pitta. Keep in your mind. Yeah, everything, even it depends on the consumption of the previous food and even the food what they have taken during the Vishrama Kala, and even if suppose Amaja Pitta is entirely different, that Niramaja Pitta is entirely different. Keep in your mind. Usually when first Vega and all, it's no chance at all of Pittanta. Even few cases, if we find that is due to Amla Pitta, influence of Amla Pitta or else any sort of gastrointestinal pathology. It's not due to Samyak Pitta or Niramagandhi Pitta. That's the difference. What we had a question. What's the difference between Vamana and Chardi? Chardi is Amagandhi Yukta and Vamana is Niramagandhi Yukta, and even the nature of Pitta is Lakshana, Sara and Pitavarna. And it is like just like egg yolk of the egg. And even it's a Guru also. That parampara he told now last 2 minutes.
Brahmasmrita issue is okay. It's my favorite topic. I always say, what is your imagination about Ayurveda? Just it's not regarding now anything about Panchakarma. What is your when you must have first arrived in Ayurveda, and you have finished physics, chemistry, and biology, and suddenly you are appearing in the Ayurveda and you are saying, hey, Vata, Pitta, Kapha, what is this? And then you come to know that there was the Acharya, then Rishis. What do you think? What is Ayurveda? Don't you have that doubt whether it is science or not really? Am I right or wrong? Yes. Yes, sir. What do you think? Brahmasmrita Ishu Vedam, when we read this line, what do you feel? What do you imagine? Brahma is sitting white tadi, and glow behind his head. Am I right? And his Siddhasana position, Padmasana position, and Ayurveda is coming out of his brain. Is it like that? Huh? Am I right or wrong? Yes. So what that feel gives you? Does that feel gives you confidence or not confidence? Honest answer I want. I don't think today's generation, or at least myself, I never got that confidence of that feeling. कोई तो बैठा है और उसने, है ना? And I'm learning that. Am I right or wrong? Because I'm science man. Everything I think I check with my logic. I recheck with the questions. I try to find the answers. I seek the answers, and then I believe it. It's my way of believing in something. Am I right? Yeah? So, what do you mean by Brahma Smruta Vishwaveda? The word Smrutva is very important. Why? Smrutva is why important. How the cognition works. Higher center जो होते हैं ना हमारे, how they work. Higher centers, how they work. Smruti is the last point. The sequence is Dhi, Dhruti, and then Smruti. Until and unless you have the Dhi and Dhruti of any topic, you cannot Smrutva. So Brahma Smrutva is the Brahma is the knowledge seeker. And he Smrutva, but when first he has observed, he checked everything. He memorized. He hold that knowledge. And then with the aim to deliver that knowledge to the society, he sat down and by remembering whatever he has observed, whatever he has perceived from the universe, he delivered it. So, whenever the Smrutva words reach fundamentally corrected, where the mistakes are there, it is corrected and then it is delivered to the society. So जो आप लोगों ने वो हिमालय के बेस कैंप लगाया था उन्होंने, and they were sitting. If you went through the names of those rishis, there were Sankhya's, Kanad, Gautam. The names of the rishis, Rishi are the scientists at that time. they were the scientists who were sitting and they were worried. There was seminar. It was seminar for the finding the answers which were faced by the society at that time regarding the health. So whatever we are learning, मैं हमेशा बोलता हूँ ये पंचावय सिद्ध सिद्धांत है सब. प्रतिज्ञा, हेतु, उपनय, निगमन एंड सिद्धांत. क्या वास्तव में प्रतिज्ञा, हेतु, उपनय, हाँ दृष्टांत नहीं, प्रतिज्ञा, हेतु, उपनय, निगमन एंड सिद्धांत. ठीक है? हाँ नहीं, प्रतिज्ञा, हेतु, उपनय, निगमन, सिद्धांत दे दो. हाँ फास्ट. हाँ प्रतिज्ञा, हेतु, उदाहरण, उपनय, निगमन. यस, ओके. सो इट इज ऑलवेज पंचावय सिद्ध. प्रतिज्ञा, हेतु, उदाहरण, उपनय एंड निगमन. एवरी लाइन हैज टू फॉलो दिस फाइव सीक्वेंसेस. जो भी चर्च में आया है वो ये पांचों प्रोसेस पार करके आया. जो भी अष्टांग हृदय में आया है वो ये पांचों प्रोसेस कंप्लीट करके आया. सो वट एवर यू आर रीडिंग, you are reading the ready material. Whatever we are doing the research, we are just validating and verifying this for our understanding. It's for our understanding. हम लोग कोई नई चीज नहीं खोज रहे हैं. मैंने वही किया, 4 से 8 ही खोजने का ट्राई किया, 1 1.5 2 ही प्रश्न खोजने का ट्राई किया. I haven't find anything new. We are just validating ourselves. यार हम लोग जो समझ रहे सही है नहीं है. मैं देखता हूँ जितने भी प्रिंसिपल्स आए, they are already tried, tested and practiced. So first you understand, process the knowledge, check it with the current physiology, and then believe it. But before discarding anything, first know the thing. Before knowing the thing, don't discard anything. Okay? So thank you very much.
Your session was really enlightening, sir. Thank you for sharing your knowledge with us today. Okay, let us end our session here. I would like to thank our beloved principal, sir, Dr. B.S. Sridhar.